being a football coach as well, we see head injuries every day, and knee injuries, ankle injuries, and I tell these guys, look, I'm not saying doctors don't know what they're doing. Obviously they do. But when it gets to the point where they tell you you need surgery or you're going to be out long term, call Dr. Cormier and at least let him look at you. We have a kid this year had a spinal injury. This kid went to Women's and Children's. They wanted to transfer him to New Orleans. And the doctors were telling him, oh, you got to go to the orthopedic. You got to go see a spine specialist. He may not walk. And I went to the hospital and I said, look, I called a friend of mine, which is also a doctor. But if it was my child and it was a spine injury, I would at least want Dr. Cormier to look at him. The way he could tell you if there's some nerve damage or what. 3 visits over here, that kid walked back on our football field and was hanging out with the rest of the team. Not on crutches, not in a wheelchair, not in a hospital bed like they said he was. The kid was on the football field walking around with his team, and he's been to every game since. We will not let him play because, that's something we just, even Dr. Chris's recommendations is, we got to let that all heal. But the kid is walking around and he's fully functional, throwing a football, quality of life, for that kid now is there. And it's just, the mom and dad told me the same thing I went through. He said, look, that first visit, she said, I was ready to pull him and run when he pulled out a light and I didn't know what he was doing. She said, but in the back of my mind, I kept hearing you say, just trust him, it's worth the visit, and see what's going on. And when his pain level dropped dramatically, they realized